Hello friends, today we will talk about headache. Headache which all of us have suffered at some point of time in our lives. So I am Dr. Shamsher Dwivedi, I am Director Neurology at Max Hospital, Dehradun, and I would like to share few important facts about headache which will help you to decide whether you need to go to the doctor or not. The most important part of the headache story is that headache is actually an early warning system like pain, which tells us that something is wrong. That something can be dangerous or very benign. So first let me tell you what are the benign causes which you can identify if you are suffering from headache and get rid of it. Just a viral flu can cause headache, a dental pain can cause headache, upper respiratory tract infection can cause headache. All these are benign causes, but besides this, the causes which go unidentified are the lifestyle issues which person is oblivious and is not aware. That includes erratic sleep or inadequate sleep, both. Not eating at the right time, your breakfast, lunch and dinner time has to be consistent and constant. You should not consume too much of alcohol or addictive substances, which are one of the major causes of headaches in our OPD. Your work posture is important. The way you sit in your office, whether you are sitting with a slouched shoulder, that can lead to headaches. So you need to first find out whether you are taking enough water, you are hydrating yourself well, eating well, you are not consuming too much of addictive substance, and that is the time when you should think that you have some kind of a headache disorder. Now, when I say headache disorder, again it is not a dangerous or serious sounding word, because 60 to 70% of the headaches are primary headaches where you get no finding on any investigations, and bulk of it is migraine or tension type headache. They affect the quality of life and sometimes leads to lot of medical leaves, but they are not life threatening or serious in terms of your body and brain. Now first I will tell you about these two headaches and then go to the last part, which is the segment where I will discuss the serious ones. Migraine is the typical headache which is associated with a throbbing sensation in the brain, pulsatile headache, associated with nauseous feeling. There is a dislike for noise and dislike for light. If these four things or at least three of them are there, perhaps one is suffering from migraine. The other is tension type headache, where there is a gripping sensation on the head or on the shoulder or on the neck. So the headache typically is a binding gripping sensation. It is mild to moderate, not as bad as migraine, but it is more or less constant for days together. Now these two headaches together constitute almost 60 to 70% of the headache patients in a OPD, and their lifestyle modification and medication helps, and maybe a CT scan can be needed in extremely rare situation because the history is very typical. But whenever a patient comes to me with a long standing headache, say somebody says that I am suffering from headache for last 10 years, I am not worried, because had there been a serious disease, it would have killed the patient. The patient is still coming after 10-year history of headache, means that the headache perhaps is benign, and typically the migraine and tension type headache patients, they come with that kind of long history. Now comes the red flags, the headaches which are associated with danger. The most important part of dangerous headache is that typically the patient will say that I have started getting headaches since last few weeks. Most of the dangerous headaches, they don't allow the patient to remain neurologically intact and mobile for a very long time. They cause some complication very soon. So typically it is a new onset headache. It is associated with some neurological deficit. Some neurological deficit like a double vision, a slurring of speech, or a weakness in the arm, or a wobbly walk. all this indicates, or a loss of control on bowel or bladder functions. So that means that there is something serious lurking in the brain which is causing a patient complain of headache, but headache is just a part of a larger story. So a first headache, a worst headache, or a new type of headache means that there is a red flag. A neurological deficit is a red flag. If there is a systemic manifestation like weight loss, loss of appetite, abdominal symptoms like pain, or if there is a history of any systemic disease, like suppose a patient who has a history of cancer, even maybe a breast cancer 5 years ago, maybe there are mets in the brain and the mets are causing headache. So if there is a significant past illness like HIV or malignancy or uncontrolled diabetes or long standing fever, say for months together, for few months, these are the warning signs that there is something lurking, and headache cannot be just, even if the character of the headache is like migraine or tension type headache, we will not leave that uninvestigated. Now once the red flags have been raised by the patient, or if the doctor on history taking understand that there something is wrong, then the patient has to undergo some kind of a brain imaging, which includes MRI or a CT scan, and blood investigations are equally important because there are many diseases like sinusitis, fungal infection of the brain, all these are reflected in blood investigations. So one has to undergo certain blood investigation, and in some situations, some clinical situation, a lumbar puncture, which is drainage of cerebrospinal fluid from the spine and sending it for pathological investigations. So this is in nutshell what all a patient might undergo if the patient has headache with red flags. Let me tell you, most of the patients of headaches who come to us in the OPD, we are able to give them some or the other solution. There are plenty of medicines and plenty of procedures which will give you relief. There is a very tiny group of patients where the headache is very chronic, and there you have to identify why it is chronic, and that normally is in the medication which the patient is taking or suffering from some other diseases or the lifestyle. Now again, before we end this talk, I would like to tell you, if it is a new type of headache, or if the headache is associated with inability to concentrate or function normally because of any reason, whether you are not able to memorize, whether you are not able to concentrate, whether you are not able to walk, if there is an interference in your activities of daily living and professional performance, then it is a time to move to a hospital and get yourself investigated. Thank you.